ladies and gentlemen. Welcome to the launch of the African Union Continental Strategy for Education, for Health and Well-being for Young People. My name is Remy Shaw from the Regional Office for Southern Africa for UNESCO, and I will help to steer the conversation this morning.
We are positive and excited that these 2 days will be of rich discussions, sharing of best practices, networking, as well as co-creation. This launch is our opportunity to share the latest development and explain how this strategy will lead us into our next phase. Ladies and gentlemen, in a special way, I welcome you. Feel free, feel at home, and I therefore declare this meeting officially open. And I thank you.
So I wanted to say thank you, dear participants, for introducing yourself. It's really wonderful to see such a diverse group from all parts of our beautiful continent. I also thank you for sharing your expectations. There's clearly a big appetite for knowledge sharing, peer learning among countries. We have 4 key objectives for the launch of this very important strategy. If I can just run through them briefly. The first is to increase awareness among key stakeholders, including member states, civil society organizations, international partners, and of course the public, about the education for health and well-being strategy. The second is to facilitate a platform for active engagement and dialogue among all stakeholders on how the strategy can be effectively implemented at the country level. Third, we want to foster partnership among diverse stakeholders to collaborate on the implementation of the strategy. And fourth, we'd like to garner commitments and endorsements from high-level government officials, policymakers, and other stakeholders to prioritize and allocate resources for the successful implementation of this strategy.
Young people in the room, IPPF, sister UN agencies, ladies and gentlemen, civil society, and other development partners. First of all, greetings from UNFPA, the Sexual and Reproductive Health Agency of UN. I bring special greetings from our East and Southern Africa Regional Director, Mrs. Lydia Jigomo, West and Central Africa Regional Director, Dr. Senan Houghton, Director of our AU Representative Office, Dr. Satarin. We, UNFPA, is really grateful, ma'am, for making us part of this development process. The good news that despite challenges, Africa has made progress. As we speak, increasingly more children, adolescents, and girls are coming to our schools. Increasingly, health promotion, life skills education is becoming core part of our curriculum in many countries. Access to sexual and reproductive health services are increasing. However, despite progress, and that brings the importance of this particular strategy, a lot needs to be done. As we speak, the teen pregnancy in sub-Saharan Africa is more than twice than the global average. Child marriage continues to be high, very high in some settings. Almost 1/3 of our girls are getting married before age 18. Majority of HIV infections are still happening in young people. 1 in 5 young person has an unmet need for family planning. Gender-based violence, particularly among young people, continues to be high. So therefore, we all are here to discuss how this particular strategy is going to improve the health and well-being of young people. We have made a lot of accomplishment, and we can accelerate the progress to meet the aspiration of the Africa we want. As UNFPA, in partnership with our UN agencies, particularly with UNESCO, UNICEF, and WHO, we fully support effective implementation of this particular strategy. In the interest of time, let me very briefly say three things which I think are really important from UNFPA perspective. The first, and we are absolutely delighted to see that we need to take advantage of the ministerial commitment which has been already made in Western Central Africa and East Africa. So we as UN agencies, we will work with Africa Union to optimize, to take advantage of the existing ministerial commitment. The second, the role of REC, the Regional Economic Cooperation. Again, huge opportunities. We all UN agencies has significant engagement with most of the RECs. We could work together to work out an action plan, how our ongoing engagement could also benefit implementation of this strategy. The third and last one, which is closest to me at least, we need to also think about how do we partner with other initiatives of Africa Union, in particular with the Karma Plus initiative. As many of you know, last year the Karma Plus initiative, that's the campaign for accelerated reduction in maternal mortality in Africa. Plus means this time they focused on adolescents' health, and that's the plus part of it. And then that's really relates to this particular conversation. So how do we optimize? How do we partner better with Karma Plus initiative? Because Karma Plus initiative is being taken to each and every country as we speak. So better collaboration with Karma, in particular, may increase the linkages between health promotion and services. And that's the interest. Lot of awareness generation, lot of agency building can happen. If the access to services are not there, in many situations, the health and well-being may not improve. Therefore, the linkages between the promotion and the services is so important. Once again, I thank AU, I thank each one of you. We are here to learn from you, and I'm grateful that we are invited. Thank you, ma'am.
It's truly pleasing to know that the African Union Commission and the African stakeholders prioritize youth at the center of the strategy to ensure a stable and adaptive education system that contribute to building young people capacities and skills for various aspects of life. The thematic clusters, which comprise of actors drawn from the education ecosystem to collectively work together and maximize impact by pooling comparative advantage expertise and resources. This cluster is to equip young people with entrepreneurial and resource management skills with an emphasis on empowering young girls to live healthy lives. In collaboration with the African Union and other partners, have developed the Continental Strategy that will help African countries equip young people with the needed knowledge and skills to achieve their full potential in an environment that facilitates their holistic development with a right-based approach. For example, higher amount of alcohol consumption in young people may increase the odds of being a heavy drinker in the early years of adulthood. Therefore, the launching of this strategy and its implementation is very crucial, as it will empower young people in improved reproductive, mental, and physical health while contributing to the achievement of education goals. Our wish is for the young people to be well informed in making the right decisions, more confident, and being able to stand for what is right. Ladies and gentlemen, the successful implementation of this strategy includes effective teaching and learning, parent and community engagement, linkage with essential services and support, and a school environment that is safe, inclusive, and health promoting. By the way of update, the African Union Assembly of Head of States and Governments held in February 2023 adopted education as the theme of the year for 2024. The launching of this strategy couldn't have come at a better time, as we are all gearing up in preparing of the year of education. I urge all of us to run with this strategy up to its end users during the year of education to bring about awareness and to continue monitoring its implementation.
Said in July 2019, the Life Skills and Career Guidance Cluster was established, and there was also a subcluster on education for health and well-being. The cluster aims to advance a collaborative agenda with focus on health, education, and wellness to maximize the potential of the young people as guided by the vision AU Agenda 2063. Also in 2020, the subcluster prioritized the development of this strategy. And the strategy has gone to the Specialized Technical Committee on Education, Science, and Technology. And they have given us a go-ahead, and it was after this strategy we got the go-ahead from the member state that the strategy was validated. And I will say again that after today's event, the strategy will be shared with member state, and I believe that through our interaction, we believe that when shared with member states, it will be adopted and implemented, and it will produce a holistic development and empowerment of the young people in Africa, which is talking about the young people's health and wellness need. Here we can see across the African region, while educating our young people, health outcomes are very important because they are steadily, it leads to improving young people's skills and their awareness as young people continue to face, health threats that affect their education and their life prospects and overall their well-being. Here we have issues that it seeks to address: the issue of HIV infection, the issue of nutrition challenges, mental health, lifestyle consideration need. So these are the things, the issues the strategy seeks to address. And when you look at the rationale and the aim of the objective, we have three rationale, three aims and aim of the objective. The first one is it reflects increased awareness of the importance of investing in the education and health of our children and the adolescent ones, which is essential for our continent to realize the potential benefits of what we call the demographic dividend. And the strategy will also provide a framework for Africa countries to ensure that all young people acquire the knowledge, skills, value, and attitude that enable them to lead healthy and fulfilled lives. to make informed decisions and respond to local and global challenges. And the last one is serves as a blueprint for the regional economic communities and AU member states to implement a collective body of health promotion work for the benefit of learners across the continent. We also have the pillars. We have 4 pillars of the strategy. We have the health lifestyle, disease prevention. The 3rd pillar is safe, non-violence, including the effective learning environment for all. And the last pillar is skill-based reproductive health education. Within each time, teaching and learning will build incrementally over the learner's lifespan, with emphasis on age-appropriate content that is curriculum-based, culturally relevant, and context-appropriate, and is also embracing vision of the AU Agenda 2063. We also have the expected result of the strategy. 4 areas of the results have been identified. We have commitment, leadership, and support. The second area is capacity strengthening at the AUC, at the regs, and the country level. We also have operational guidance, foundation and system in place. We also have the last one is monitoring, reporting, and a learning agenda to advance the strategy. So whatever we do, we should have the monitoring of it, the reporting, so that we know, we learn lesson, we know where we are having challenges, and we know the way forward. In conclusion, the AU Education for Health and Wellbeing Strategy is a comprehensive plan that it aims at advancing education for health and well-being in Africa. We can see there, it outlines specific objectives and areas of focus, shaping a brighter future for African youth. The strategy has, it has unified commitment from member states, from regs, civil society, and various stakeholders that's essential for successful implementation. It also aligned seamlessly with global initiatives, including the Sustainable Development Goals. The strategy also places a strong emphasis on youth engagement. It encompasses life skills, health and well-being. It also, the strategy also has built-in mechanism for monitoring and accountability. The strategy represents an opportunity to build a more cohesive approach, to health promotion. Moving forward, we need to develop a monitoring and evaluation framework, or we need to align it with existing ones. We also need action plans at the level of regs to ensure the successful operationalization of this strategy. There's need for us to rally together to support this strategy for a healthier, more prosperous future for African youth.
On behalf of the government and people of Ghana, particularly on behalf of the 7 million young people in Ghana, we bring you greetings and congratulate all our joint governments for the single remarkable achievement, our coming together to witness the launch of this Continental African Union Education, Health, and Well-being Strategy. Permit me to mention a few of these interventions currently being implemented for adolescents and young people. We have the free senior high school policy, prevention of adolescent pregnancy and girls' re-entry to school after birth guidelines, HIV prevention education in schools, national safe school policy, reproductive health education, the folic iron supplement for adolescent girls, adolescent and youth responsive service delivery. We also have the school health education policy revision, which will take feed from the WCA commitment and the Continental Strategy for Education for Health and Well-being and Service Delivery Program, integration of sexual and reproductive health education into complementary basic education for out-of-school young people. As a country, we pledge to work tirelessly to ensure that every adolescent and young person in Ghana benefits from quality education, inclusive sexual and reproductive health services, and a supportive environment to thrive, develop, and become a good African citizen who will be an effective change agent for the continent's sustainability development. As a major milestone within the 1.8 billion Young People for Change campaign convened by PMNCH, we are delighted to have been involved in this process, leading to the launch of the West and Central Africa Commitment and now the Continental African Union Education and Well-being Strategy. We give you the assurance that the Ministry of Education and Health will deepen our existing efforts to promote educated, healthy, and thriving adolescents and young people for Ghana, for the national development and the continental development.
Let me state from the onset that Namibia as a country values the well-being of the young people and their future. Therefore, the country makes a substantial investment in the adolescent and young people in school or out of school to ensure the country has a responsible and productive citizens. The government has various programs and policies in place to work towards ensuring the health and well-being of our children. This includes the Integrated School Health Program and Policy, a National Safe School Framework, the Integrated Physical Education and School Sports Policy, life skills-based HIV, AIDS and health education, and our syllabus, to name but a few. There is political will in the country, as demonstrated by the Cabinet's endorsement of the continuation of the Eastern and Southern African Commitment 2021 to 2030 in 2020. This was done with the aim to empower adolescents and young people with the necessary knowledge and skills, with the use of acceptable terminology and material to enable young people to make the right choices and decisions concerning their lifestyle. Namibia hereby reaffirms its commitment towards health and well-being for young people.
Nigeria fully endorses the African Union Continental Strategy on Education for Health and Well-being, recognizing it as a pivotal milestone in our collective efforts to empower and nurture our adolescents and young people. The strategy aligns with recent commitments that Nigeria has endorsed, including the West and Central Africa Commitment for Educated, Healthy, and Thriving Adolescents and Young People, in addition to other national policies and strategies, amongst which are the National Policy on Gender in Education, in Basic Education, National Policy on HIV and AIDS for the education sector in Nigeria, National Policy on Special Needs Education in Nigeria, National Policy on the Health and Development of Adolescents and Young People in Nigeria, the Family Life, HIV and Health Education, National Policy on Safety, Security, and Violence-Free Schools, all of which underscores Nigeria's commitment to the health and well-being of our teeming adolescents and young people. Our commitment extends also beyond mere words. We pledge to work tirelessly to ensure that every adolescent and young person in Nigeria benefits from quality education, inclusive reproductive health services, and a supportive environment to thrive, develop, and become a good African citizen who will be an effective change agent for the continent's sustainable development. As one of the champion countries for this new strategy, we stand ready to lead by example, and we share our experiences and successes with other member states. Together, we can create a brighter, healthier, and more prosperous future for our youth, not only in Nigeria, but across the entire continent, to achieve the Africa we want. Thank you.
In 2013, South Africa hosted and endorsed the endorsement of the East and Southern African Commitment. The Honorable Mrs. Angelina Mutsecha committed the sector to the implementation of comprehensive sexuality education and the provision and ensuring the access of health services in all South African public schools. So South Africa is present to the challenges faced by adolescent and young people in the country, including the high infection rates of HIV, especially amongst the young girls and young women, the unacceptably high teenage pregnancies, and the lack of access to health-friendly youth services in our clinics, the gender-based violence, and the child marriages in the continent, just to mention a few. The Department of Basic Education is proud to share some significant progress in few achievements in the efforts of implementing the commitment. And I'm proud, Program Director, to indicate that in 2017, the Cabinet approved the Department of Basic Education National Policy on HIV, STIs, and TB for all learners, educators, school support staff, and officials in all primary and secondary schools in the basic education sector. Chair, it is an honor for me to affirm the commitment of South Africa to the strategy. Thank you.
South Sudan, as you all know, is one of the youngest countries that has just come out. But it has committed itself to these commitments. Starting from 2021, commitment that was made, the ESA commitment. And in this, again, it is committed by signing the Maputo Protocol this year. And we say that with this, we are not going to work alone. South Sudan is going to work with all the line ministries to support this launch, this health policy that is going to be launched today. We are committed, and we are thankful to be among the 10 champions. Thank you.
Zambia is one of the countries that mainstreamed comprehensive sexuality education in the school curriculum years ago. And we have a very good working relationship with other line ministries to ensure that this is implemented together with the support of cooperating partners and civil society organizations. On behalf of the Republic of Zambia, we, the Ministers of Education, Health, Youth, Sport, and Art, reaffirm our vision of supporting young people to be national, regional, and global citizens who are educated, healthy, resilient, socially responsible, and informed decision makers with the capacity to meaningfully contribute to their communities, countries, and regions' development. We are united in our understanding and deep concern that child marriage and teenage pregnancy are harmful practices and a violation of human rights which negatively impact on children's personal development, future opportunities, education, health, and well-being, with detrimental consequences for families, communities, provinces, and the nation at large. Zambia will implement the framework taking into consideration the results of the ongoing consultations to review and update the comprehensive sexuality education framework, including the cultural values and the national context in line with the Zambian Constitution. In view of the launch today, Zambia remains committed to the implementation of the Continental Strategy for education, health, and well-being for Zambia, for the young people.
La République du Congo soutient pleinement la stratégie continentale de l'Union africaine sur l'éducation pour la santé et le bien-être, qu'elle considère comme un jalon essentiel dans nos efforts collectifs pour autonomiser et éduquer ces adolescents et ces jeunes. Cette stratégie s'aligne avec les récents engagements pris par la République du Congo, notamment l'engagement de l'Afrique de l'Ouest et du Centre pour des adolescents et des jeunes éduqués en bonne santé et épanouis. La stratégie sectorielle de l'éducation 2021-2030, la stratégie en santé de la reproduction maternelle, néonatale, infantile et de l'adolescent 2022-2026 et le plan national de développement PND 2022-2026, la République du Congo verra à ce que l'engagement de l'Afrique de l'Ouest et du Centre et tous les autres instruments dont nous sommes signataires soient mis en œuvre de manière cohérente et redevable. Nous collaborerons étroitement avec nos partenaires régionaux et les communautés et nous nous engagerons à autonomiser nos jeunes afin qu'ils jouent un rôle actif dans la construction de leur avenir. Nous nous engageons donc à promouvoir un mode de vie sain englobant la nutrition, l'activité physique et le sport, le sommeil et le bien-être, la gestion positive du stress, de l'abus d'alcool et d'autres substances par le biais de programmes complets d'éducation et d'information. Prévenir les maladies, qu'elles soient transmissibles ou non, en liant l'éducation et la santé, en renforçant la collaboration entre les secteurs de l'éducation et de la santé à tous les niveaux, notamment en améliorant la qualité et la couverture des services de santé scolaire. Promouvoir des environnements d'apprentissage sûrs, inclusifs et non violents pour tous, en lien avec les services, en veillant à ce que les écoles et les environnements d'apprentissage communautaires soient plus sûrs, plus sains, plus conviviaux pour les jeunes et plus inclusifs pour tous les apprenants. Soutenir une éducation pour la santé basée sur les compétences qui promeuvent l'importance et l'utilité des services de santé sexuelle et de reproduction et d'autres services de santé pour les adolescents et les jeunes scolarisés et non scolarisés. Veiller à ce que les fonds nécessaires soient consacrés à la mise en œuvre de cette stratégie. Nous nous félicitons du soutien de nos partenaires techniques et financiers pour mener à bien la mise en œuvre de cette stratégie. Renforcer nos systèmes de suivi et d'évaluation pour contrôler la mise en œuvre de la stratégie et ses résultats pour les jeunes Congolais. Notre engagement pour le bien-être des adolescents et des jeunes est aligné avec la stratégie de l'Union africaine en matière d'éducation, de santé et de bien-être. On repense l'appel du secrétaire général des Nations Unies pour un engagement national et mondial afin de mettre en œuvre le plan de sauvetage pour l'humanité et la planète. Lors du sommet 2023 sur les objectifs du développement durable, ODD, ce qui contribuera à conduire la transformation des ODD en faveur de l'inclusion et de la durabilité dans les années à venir, et en soutien au Forum mondial pour les adolescents, le plus grand rassemblement des parties prenantes au monde, réseau des jeunes, gouvernement, secteur privé, donateurs, agences des Nations Unies et autres pour attirer l'attention sur la nécessité d'une action immédiate pour faire progresser les principaux déterminants du bien-être des adolescents comme une étape majeure de la campagne 1,8 milliard des jeunes pour le changement, organisée par le Partenariat pour la santé de la mère, du nouveau-né et de l'enfant.
La Côte d'Ivoire soutient pleinement la stratégie continentale de l'Union africaine sur l'éducation pour la santé et le bien-être, qu'elle considère comme un jalon essentiel dans nos efforts communs pour autonomiser et éduquer les adolescents et les jeunes. En effet, cette stratégie s'aligne sur les récents engagements pris par la Côte d'Ivoire. Il s'agit notamment, d'une part, de l'engagement de l'Afrique de l'Ouest et du Centre pour des adolescents et des jeunes éduqués, en bonne santé et épanouis, et d'autre part, de notre politique stratégie nationale d'éducation complète à la sexualité, éducation à la santé et à la vie saine. Ainsi, la Côte d'Ivoire veillera à ce que la stratégie, l'engagement de l'Afrique de l'Ouest et du Centre et tous les autres instruments dont elle est signataire soient mis en œuvre de manière cohérente et redevable. Notre engagement ne se limite pas à de simples mots. Nous nous engageons à travailler sans relâche pour que chaque adolescent et chaque jeune de la Côte d'Ivoire bénéficie d'une éducation de qualité, de services de santé sexuelle et reproductive inclusifs et d'un environnement favorable pour s'épanouir, se développer et devenir un citoyen africain de valeur, un agent de changement efficace capable de conduire notre continent vers un développement durable pour le bien de tous. En tant que pays champion de cette nouvelle stratégie, nous sommes prêts à montrer l'exemple et à partager nos expériences et nos succès avec les autres États membres. Ensemble, nous pouvons créer un avenir plus radieux, plus sain et plus prospère pour nos jeunes, non seulement en Côte d'Ivoire, mais aussi sur l'ensemble du continent, afin de réaliser l'Afrique que nous voulons.
J'ai le privilège de me trouver devant vous aujourd'hui pour représenter mon pays, le Burkina Faso, pays des hommes intègres. Nous avons l'honneur d'être l'un des 10 pays champions de la stratégie nationale de l'Union africaine relative à l'éducation pour la santé et le bien-être. Le Burkina Faso soutient pleinement la stratégie continentale de l'Union africaine sur l'éducation pour la santé et le bien-être, qu'il considère comme un jalon essentiel dans nos efforts collectifs pour autonomiser et éduquer ces adolescents et ces jeunes. La stratégie s'aligne sur les récents engagements pris par le Burkina Faso, notamment l'engagement de l'Afrique de l'Ouest et du Centre pour des adolescents et des jeunes éduqués en bonne santé et épanouis, et sur notre politique nationale, à savoir l'éducation à la vie familiale et des EVF, dont les modules sont déjà intégrés dans les programmes des écoles des enseignants du primaire. Le Burkina Faso veillera à ce que la stratégie, l'engagement de l'Afrique de l'Ouest et du Centre et tous les autres instruments dont nous sommes signataires soient mis en œuvre et de manière cohérente et redevable. Alors, notre engagement ne se limite pas à des simples mots. Nous nous engageons à travailler sans relâche pour que chaque adolescent et chaque jeune du Burkina Faso bénéficie d'une éducation de qualité, des services de santé sexuelle et reproductive inclusifs et d'un environnement favorable pour s'épanouir, se développer et devenir un bon citoyen africain qui soit un agent de changement efficace pour le développement durable du continent. En tant que pays champion de cette nouvelle stratégie, nous sommes prêts à montrer l'exemple et à partager nos expériences et nos succès avec les autres États membres. Ensemble, nous pouvons créer un avenir plus radieux, plus sain et plus prospère pour nos jeunes, non seulement au Burkina Faso, mais aussi sur l'ensemble du continent, afin de réaliser l'Afrique que nous souhaitons.
We all have heard that the goal of this strategy is to improve the reproductive, mental, and physical health of young people while contributing to the achievement of education goals. And this epoch-making event today, we have the participation of young people who are eager to share their reflections on what this strategy means for them.
Aujourd'hui, on a un sérieux problème au niveau de la nutrition, parce que l'agriculture est vue parfois autrement. Je prends par exemple dans la plupart de nos sociétés, il peut avoir un jeune qui travaille dans un bureau où les conditions sont réunies, mais parfois avec un salaire minimum seulement de $150. Il se peut. Mais on peut voir encore un autre jeune qui est agriculteur et qui a pratiquement 2 hectares à son actif, mais qui quelque part convoite celui qui est dans un bureau. Au-delà de ça, on voit le pourcentage de criminalité qui ne cesse de gonfler au niveau également de l'Afrique, avec la vente de la drogue ici. Brillant, peut-être intégrer des programmes de développement personnel au niveau de nos continents. Nous devrions également promouvoir ces programmes-là, que ce soit au niveau scolaire, intégrer des cercles de réflexion où les questions de développement personnel sont abordées.
Selon les estimations, 246 millions des apprenants sont victimes chaque année de violations, que ce soit à l'intérieur ou bien à l'extérieur de l'école. 73 millions d'enfants vivent dans l'extrême pauvreté, l'insécurité alimentaire et la faim, sans compter les grossesses précoces. Les complications liées à la grossesse précoce sont la principale cause des décès des filles âgées de 15 à 19 ans. Et la pandémie du Covid-19 est un puissant révélateur des besoins non satisfaits des apprenants et de leur santé mentale. Pour rebondir aux recommandations, donc pour moi, il s'agira dans un premier temps de renforcer les activités de sensibilisation à l'école par des clubs EVF à travers des leçons de vie, des groupes de parole. Renouer le dialogue ou renforcer la communication entre parents et adolescents sur la question liée à la santé sexuelle et reproductive des adolescents et jeunes. Mettre en place un dispositif qui permet la réintégration à l'école des filles mères. Renforcer les relations entre l'école et les structures de santé pour une meilleure prise en charge des adolescentes, espaces dédiés aux jeunes. En plus, intégrer l'éducation à la santé et au bien-être ados et jeunes dans les enseignements d'apprentissage. Équiper et renforcer les personnels pour mener des actions de prévention sur les grossesses précoces et faire de l'offre des services sur la santé sexuelle et reproductive des ados jeunes.
Selon moi, il n'existe pas une compétence spécifique. Je pense que toutes les compétences sont importantes. Tous les jeunes doivent être capables d'acquérir toutes les compétences en même temps. Il faut une approche holistique. Et je m'appuie sur un document qui s'appelle Our Future Adolescent Commission on Adolescent Health, qui a été écrit par Palton et d'autres experts en éducation à la santé. Ça appuie un peu ce que je disais, il ne faut pas une seule compétence spécifique. Nous ne devons pas on ne doit pas accentuer ou se concentrer sur une seule compétence. Mais si je dois répondre, je parierais sur la compétence de l'esprit critique et la capacité de prendre des décisions éclairées. Parce que ces deux compétences, elles sont exploitées par les jeunes tout au long de leur vie. Donc lorsqu'ils réfléchissent sur tout ce qui est santé sexuelle et reproductive, dans le cadre de leur couple, mais aussi dans le cadre de la planification familiale. Donc pour moi, ça permet de guider de manière durable et pérenne. Donc ça revient aussi à prendre en compte l'éducation et l'information. Donc rendre aussi accessible l'information à tous les jeunes. Il faut qu'il soit notamment dire que le document est certes inclusif, mais il ne met pas en avant le rôle des jeunes. On a vu le rôle des parties prenantes, du gouvernement, des agences de coopération internationale, de la Commission de l'Union africaine. Mais lors de la présentation, je n'ai pas vu un moment où on mettait le rôle et les responsabilités des jeunes. C'est important de le mettre, c'est important d'être impliqué, donc je pense que c'est important à prendre en compte aussi. Et j'en profite pour faire du coup un petit plaidoyer sur l'appropriation. C'est un mot qui est ressorti dans le document. Donc l'appropriation et le leadership du document. J'appelle aujourd'hui, nous avons l'opportunité d'avoir la délégation de la Côte d'Ivoire et je voudrais l'appeler à prendre part à une démarche pour élaborer un projet de loi sur la santé reproductive.
The strategy is very comprehensive, well drafted, and will see to it that young people are in a better position to prevent both communicable and non-communicable diseases if the strategy is well implemented as it is being designed. So that is where I want to start from. We have a very comprehensive strategy that is capable of empowering the young people to prevent both communicable and non-communicable diseases. That is if the strategy is well implemented effectively and having the young people at the heart of the implementation. But for practices that are very common among young people when it comes to disease prevention, we can see from my experience working with other young people and from the little research I have done, we can clearly tell that young people do not consciously, I would say it's just a few that are conscious about disease prevention.
This is a song by King Kaka from Kenya. It's a powerful song called Bashte Yangu. It was done in collaboration with UNESCO, and it's about promoting friendship, emotional support, and self-expression to break stereotypes, embrace vulnerability, and openly discuss issues, especially among young men, highlighting the importance of knowing your HIV status. It's called Bashte Yangu, and so please, as you walk down, may you please dance to this song. And Patricia, feel free to lead the dance and celebrate the launch.
Kama ni noma, just the plan, uko hapa lakini akili mbali gani? Sumekuwa na mresh mali safi, complaints nimezisikia kwa majirani, mavita tena karibu rushwe ndani, vile una handle vitu ndio urazi, najua kutafuta kazi ndio kazi. It's possible, nauliza who's with me, usi lose rhythm.
Hey beshte yangu, barua nimesaini natumai kufikie. Beshte yangu, I hope uko poa uliko. Beshte yangu, sometimes beshte yangu, utakuwa sawa uliko. Oh la la la, oh la la la, alright. Oh la la la, oh la la la, alright. Oh la la la, oh la la la, alright. Oh la la la, oh la la la, alright. Beshte yangu.
Around last week another friend akanicall, ilikuwa 5-6 hivi na recall. Kambana ni kama kameumana, naona kambana ni kama amenikana. Mimi huyo like a friend nika come through. By the bedside amekaa tu, mkono kwa shavu anawanda. Kings unajua been faithful na one guy, and the test doesn't look good, and I don't know what to do. It's possible to leave, usi lose rhythm.
Hey beshte yangu, barua nimesaini natumai kufikie. Beshte yangu, I hope uko poa uliko. Beshte yangu, sometimes beshte yangu, utakuwa sawa uliko.
My friend, we'll be okay. We have to check up on our friends. Remember our rights, our lives, our future, and our welfare is very important. Check up on your friends. And if you're not okay, it's okay not to be okay, man. My friend, you will be okay.